Now, as South Africa undergoes processes in dispensing the first batch of its vaccines, concern has been raised about vaccine hesitancy and how it can derail plans to achieve herd immunity. In 2019, the World Health Organization identified vaccine hesitancy as one of the 10 greatest threats to global health. Vaccine hesitancy poses significant risks for those refusing to be vaccinated as well as the wider community. This evening, we discuss this phenomenon against the backdrop of the right to health and safety versus the right to refuse vaccination. Joining us now for this discussion is Mark Heywood. He's social advocacy activist and editor of the Maverick Citizen. And Professor Alex van der Heever is a chair of the social security at Wits School of Governance. And we're also joined by Dr. Benjamin Roberts, research director at the Human Sciences Research Council, the Developmental, Capable and Ethical State Division. Thank you to you all, and thank you so much for joining us.
Good evening, and thank you.
Thank you. Okay. Let me just start with you, Mr. Heywood. You obviously are very much connected to the grassroots, what happens at community level. What have been the main causes of vaccine hesitancy?
Well, I think there are really two sets of causes. The first is just a normal anxiety, perhaps fear of something that is new in the context of an epidemic and a virus that anyway causes a lot of fear. And the way to address that fear and anxiety is to have public health campaigns that explain to people that the vaccines that are being made available are completely safe, to explain to people just how it is that the vaccines work in reducing people's risks or taking away people's risks of illness, severe or mild illness due to COVID-19, and then explaining the very positive benefits to the individual, but also to the community. And I believe that if we do our homework as civil society, as government, then the vast majority of people in South Africa will willingly come forward to take vaccines and will benefit from those vaccines. So that's I think the main thing behind hesitancy. Of course, there is another problem, which is that there's a very small group of people who are campaigning against vaccines for ideological reasons and are spreading misinformation and confusion that are designed to instill fear. Now, okay, we have to work against that
Mr.
misunderstanding.
Heywood, let me stop you there for a moment, because I'd like to bring in Dr. van der Heever to hear his point of view. That gap, does it exist because of dissent within the medical and scientific community? Partly because some say there's just not enough information known about COVID-19, and the dissonance actually arises from the efficacy in developing COVID vaccine because of that lack of information. I mean, we've seen videos of doctors saying, here's why you shouldn't get vaccinated.
Yeah, so I think that there's a concern with how people weight the evidence presented to them. And in many environments, people receive information that they regard as more truthful potentially than information coming from what might be regarded as more official sources. But the reality of this situation is that there is an immense weight of information that supports the use of vaccines and supports the fact that it is safe and efficacious. And it would be incredibly difficult for any kind of weird conspiracy to actually result in such a degree of consensus within the scientific community on vaccines. So I think that it's again, where do people get their information, and why do they believe in small bits of information that suggests an alternative story or a conspiracy theory? And I think that comes down to often a mistrust of official possessions and government. And the reality is you can mistrust government and yet still weight your information correctly. And I think that's why it's going to be incredibly important that there's a wide consensus that is beyond government, that says that provides real solid information and information that people can check, and suggest strongly that they do not just take the advice of somebody who's whispered in their ear or that came from the internet.
But Professor van der Heever, what I find problematic, and I'll ask you, Dr. Roberts, to respond to this, because you say, where do people find their information? There has been evidence that there was an increase in the numbers of anti-vaccination web pages in South Africa between 2011 and 2013. So this is not a new phenomenon, but the bottom line is that there have been actual conversations that have taken place that, obviously taken out of context, give people a real fear. So where do we balance this, the right to health of an individual and that of communities? Dr. Roberts?
Yeah, thanks. The sort of survey-based work we've been doing jointly with the University of Johannesburg has looked at, firstly, levels of vaccine acceptance versus hesitancy, and we find about 2/3 are willing to accept the vaccine, with only about 18% saying they probably or definitely would not get it, and about a further 15% somewhat uncertain. If we also ask people in their own words to express why, what is the reason for both acceptance and hesitancy. And in terms of conspiracies, we were actually quite surprised that it wasn't a dominant response on the hesitancy end of the spectrum. It was only mentioned by about slightly under 10% of respondents. More dominant concerns relate to issues around concern about potential side effects, about the effectiveness, about an appeal for more information around the scientific evidence. So it relates back to what Mark was saying about the need for more, for real vaccine literacy campaigning at this stage.
So, Mr. Heywood, let's continue with that discussion, and how do we strike that balance? And I want to understand from your point of view and your interactions, where do the two converge? As we mentioned, the interests of the community, in which there is, some would say, an ethical or moral argument made in favor of vaccination. But some people say, I don't want to be an experiment. So do you agree with that concern by health experts, the lack of targeted and coherent messaging, and how can, we improve on that?
Look, our messaging is simple. These vaccines are safe, they are efficacious, they are in your self-interest, and they are in your community's interests. They are in our country's interests. It's as simple as that. They are medicines that have fewer side effects than many of the medicines that we prescribe for ordinary illnesses on a day-to-day basis. They have been extensively researched. The research didn't start when COVID-19 appeared approximately a year ago. Research was going on into respiratory illnesses. You've heard of SARS, the severe acute respiratory syndrome, MERS, etc. These vaccines have been built, HIV have been built upon decades of research into viruses. And those are the key messages. And another thing I would say, Sapiso, is people say we don't want to be part of an experiment. Well, nobody is being part of an experiment as we start to roll this out. The vaccine trials that led us to understanding that they are safe and work are ongoing, but whether you want to go onto a vaccine trial is a matter for you. That is different from the rollout that is now taking place across our country. But to still allay fears. And as I said, people are scared. Let's face it, people are scared for one reason or another. We have to do almost what we did successfully eventually with HIV, because if you remember, Sapiso, there was fears and there was misinformation about antiretroviral medicines. And what we did with HIV was we started massive campaigns of treatment literacy where we took the science of medicine into the communities, explain to people so that they could understand for themselves, so that people said, yes, this is clearly in my interest, my family's interest, my community's interest. And that's what we're going to have to do this year again, as we try to reach population immunity through a massive vaccination campaign.
And Professor van der Heever, this is the thing. Countries such as Australia, for instance, are talking about that it has to be compulsory if you are to achieve any form of herd immunity. But there are those who say there must be a clear distinction between individual health rights and public health rights. Is one a prerequisite to the other?
Well, I'd say it's very difficult to mandate certain things. And what you will always rely in any mandatory environment is on a large degree of voluntary consent in any case. So I think it's very important that people, on the whole, have an understanding of what is happening. And that means that the messaging and information and the accurate information does need to be out there, because when the questions do arise, people do need to understand the issue. There already, from a safety perspective, millions of doses have already been administered. Millions. So if people were going to face a safety problem, we would know about it. So I think that the issue is not relying on a mandatory process alone is important, because people will find many ways to circumvent a mandatory process. So voluntary consent is important, and you will reduce the number of people who don't consent to a very small number, and that will be, at the end of the day, the best potential result. They will probably develop natural immunity through getting infected, but that will place them at risk. But I think that there's no other solution than to get people to trust in this process.
And Dr. Roberts, ultimately it's about informed consent. So looking back at our public policy documents and implementation, Mr. Heywood referred to it, what happened with regards to HIV/AIDS, but let's look at our own track record as South Africa. How have we made advances in a number of immunization programs over the past 20 years?
I think, Shabi, if I can bring it back to the UJHSRC survey results, I think what's interesting is quite large shares do give their consent. 67% are willing to accept a vaccine voluntarily. Some of the dominant reasons for that around a desire to protect the self as well as others in our communities and society at large. So that's quite a dominant reason that informs a majority share saying they would accept a vaccine. So I think the kind of the campaigning that's happened previously over, in relation to HIV/AIDS, etc., has actually shaped this kind of view of vaccines at large. Yes, there is a hesitant minority, and the kind of messaging and literacy that needs to happen will hopefully, by putting the science and information required out there, address those lingering concerns that citizens continue to voice to some degree.
But Dr. Roberts, I just want to understand, how have we achieved progress? Because we talk about misinformation and disinformation, and obviously there's a clear distinction between the two as well. So in instances where people have made statements or shared information which may dissuade people from vaccination, is it deliberate? Is it something that you can do from a public policy point of view? Dr. Roberts?
I think so. And in terms of the level of confidence that people, trust and political trust in particular, as well as trust in science, are key factors in this. And certainly what we're seeing is the demographic characteristics or drivers of patterns of acceptance and hesitancy fall away for the most part when one controls for factors related to trust. So particularly trust in the way leadership is handling the pandemic is paramount. It is one of the most sizable effects that we find in forming views around vaccination. So I think that's a good foundational place or foundational message to focus on and build on as part of that messaging that needs to come. There are some questions about the science that we see, but they are not overriding concerns. There are questions to some degree about side effects, about effectiveness and elements of vaccine distrust, but really underlying that all is really an appeal for more information. And that's what's coming out in terms of people's own expressions and motivations for why they have some reticence. And I think with the campaigning that can happen and with transparent leadership and coupled with campaigning, we can really begin to make a difference and ensure that voluntary consent ramps up.
Mr. Heywood, just your thoughts on this. Obviously, it's a rights issue, but there are some airlines, Qantas, for instance, is saying they may impose a strict rule that if you're not vaccinated, you can't get on any of their airlines. There's some who are even saying that the Commonwealth may even consider withholding certain social security services if you are not vaccinated, so no jab, no pay. I mean, you want to nudge people along, but the health minister himself also said, well, it's fine, you can choose not to be vaccinated, but it means that you'll probably lose out on certain rights.
Well, okay, let's start here. President Ramaphosa said 2 nights ago, categorically, no one will be forced to have the vaccination. That has to be our starting point. No one will be forced. I think the vast majority of people, even bigger than the 67% that came out in the HSRC survey, when they understand fully and are able to give informed consent, will want to be vaccinated and will give consent. And that is our starting point. And I think it will remain our position in this country. Now, as you mentioned, we're already hearing of some countries that are saying you can't come into this country if you haven't had a vaccination. Some airlines that are saying you can't come in if you can't travel if you haven't been vaccinated. I don't know if we in South Africa have power. In fact, I don't think that we have power over what other countries do, rightly or wrongly, reasonably or unreasonably. Sabisa, there may be, nobody will be forced to have a vaccine, but there may be a limited number of circumstances, even in our country, where having been vaccinated becomes a requirement for something. For example, you wouldn't allow people who haven't been vaccinated to work with highly vulnerable populations to COVID-19. You would want to protect those populations. But I don't think that the vaccination thing is going to involve a trading of fundamental rights at all. And I almost think that is somewhere we don't even need to go, because at the moment, as we're having this discussion, we haven't had one person vaccinated in South Africa through a public or private program yet. We need to concentrate on getting all of those people who want to be vaccinated, which is millions of people.
Okay.
And once we've got those millions of people vaccinated, perhaps we can have a debate about the smaller number of people who may be resisting and what threat they may pose to other people's rights.
All right, but Professor van der Heever, the reality is that ultimately it does also come down to civil and criminal liability. So I want to talk about the exceptions. I mean, as a scientist, you can tell me, so if one is administering medical treatment, are there exceptions? Because it's a matter of, for instance, whether or not, so perhaps in some cases consent wouldn't have been granted, but the requirement, it's about whether it's necessary, it's essential, as opposed to if it's elective from the medic's point of view.
Sorry, just to understand the question, are you...
So I'm looking at the exceptions. When somebody can be vaccinated and they perhaps are not in a position to grant consent. I mean, it's not like you're going to sign a form, I'd imagine, to say, I do not want to be vaccinated, unless you believe so deeply in it.
Yeah, so where they're not in a position to give consent, let's say for medical treatment, just note that the vaccines don't take effect immediately. So it's very unlikely that there will be a situation where somebody's like vaccinated before they're allowed in the hospital when they come in on a stretcher. But I think that the requirement for informed consent is very important, and part of informing the public forms part of that. But I do think that our debates are actually going to be around who we're excluding from vaccination as opposed to who we're trying to include, because we've had a position that government has stated that it doesn't want to vaccinate illegal immigrants, for instance, and that is completely irrational from a sort of a pandemic management perspective. It's another version of vaccine nationalism. So on the one hand, you can't complain about Canada and Europe and then do the same yourself, and we are. So I think that the important issue is that we've got to focus on who wants to be vaccinated. Right. To the extent of any liability that might extend from refusing, I'm not sure that that would apply, because you'd have to create a direct link between that person and a particular incident. But I think those are going to be very minor issues down the line.
And Professor van der Heever, thanks for that. Just to say, though, that in a Q&A section we had with the Health Minister, when asked this question about the vaccination of foreign nationals, he did say that it is something that is on the table that they're going to have to discuss, because it's a reality that they're faced with. But just to end off, Dr. Roberts, scientists and policymakers obviously also have to understand the scale of the problem. So from what everyone is saying at the moment, that it's not such a big problem, but what can we improve in the tailored and targeted strategies to address this issue?
I think first it goes back to what Mark was talking about. Let's focus on the large share and majority share of the public that do want to have a vaccine. As you indicated, that's many millions of South Africans. So that's the first thing, is let's start getting injections and arms and start the rollout proper. I think beyond that, it fundamentally is about starting to address those pockets of concern amongst the public. And the best way to do that is by firstly starting a rollout and seeing that people are successfully being vaccinated, and they're not having the kind of level of side effects that people are fearful of. And backed up with clear messaging and other forms of literacy.
Okay, thanks a lot. We're going to have to, unfortunately, end it there. And I do apologize for cutting you off, but I'm sure you would have seen the warning that we are running out of time. Thanks to all of you for taking part in the discussion and enlightening us on these issues. Mark Heywood, social advocacy activist and editor of the Maverick Citizen, and Professor Alex van der Heever, who is chair of the Social Security at Wits School of Governance. And thanks to you as well, Dr. Benjamin Roberts, research director in the Human Science Research Council at the Developmental, Capable and Ethical State Division.